So we're going to be doing a lymphatic drainage exercise for the head. This exercise is going to be really nice when you have that fluid pressure system in your head. So if you have headaches, if you have some heaviness behind your eyes, or even if you have a sinus congestion, this is going to be great to kind of move that fluid back down towards the heart. Okay, so to start, we're going to begin with some diaphragmatic breathing, taking some deep breaths into our belly. Inhale and exhale for a count of 6, 2, 3, 4, 5, 6. We're looking for deep, slow breaths. And what this is going to do, this is going to just kind of move. Our diaphragm is in the middle of the body over here. So it's going to just move the pressure systems into our thorax, into our abdomen. It's going to just start the lymphatic system activating with this portion. You want to do diaphragmatic breathing for about 1 minute. After you have a minute or two of breathing into your belly, we're going to be activating our lymphatic ducts. So for the lymphatic duct, you're going to find your clavicle, which is your collarbone over here. You're going to go on the medial edge of your collarbone to start. And if you place around 3 fingers, it should be approximately around the 2nd or 3rd finger back to the side. And you can see over here, can you lift up your head for 1 second? You can see how her muscle pops up in here. That's your sternocleidomastoid. You're just going to go just outside of that. Go ahead and relax. And so you're going to find a space where your finger can enter behind the collarbone, just like that. And you're going to be pushing deep. It's going to be a firm, deep pressure, but not as hard as doing a deep tissue massage or something like that. This should be completely comfortable. And so you're going to press for 3 seconds and gently release. And press for 3 seconds and gently release. This is going to stimulate the lymphatic duct in this area, which is going to take in all of the lymphatic fluid from both of your legs, your left arm, and your head. So now when you're doing this on your own, you can take 3 fingers on each hand because you want to get both sides. Put your 4th finger right at that medial tip of the collarbone right in here, from here. And so you're going to hook your fingers around and see where you can get behind that collarbone. So if you're finding that there's a little bit too much tension in your neck, you can add an extra pillow and lift up your head so that you put some of these muscles on slack. And then your fingers should be able to go in a little bit deeper behind the collarbone, still without any pain, and just a firm, nice firm pressure to activate those lymphatic ducts. 3 seconds in and 3 seconds out. And do this about 10 times or so after you've done a minute of your diaphragmatic breathing. After that, you're going to take your fingers and you're going to start doing semicircles onto your skin. And so for this one, you want to actually pick up the skin and let it go into half circles. So you're going to pull up and then release. Pull up and release. So if you're doing this on your own, you can take your opposite hand and just grab some skin, pull up and release. And so you're just going to be creating that half moon shape on each area. You can do this anywhere on your skin that feels a little bit tight or a little bit swollen. You can start all the way from your shoulders, go all the way forward, go all the way back, and you can even bring it up all the way up behind your ear, behind your jaw, especially right behind your jaw, just underneath this ear. This is a good area where we have a bunch of lymph nodes that's going to be draining our head. And so you can do these semicircles just behind the ear. This should feel really comfortable, really comforting. Just pulling that skin up into a semicircle. And so I would say do these semicircles around 7 to 10 times in each location. So this exercise should take you about 5 minutes overall, including the diaphragmatic breathing and the thoracic duct pump and the superficial fascia, or the skin. Meanwhile, don't forget your diaphragmatic breathing, because that's going to be maintaining the pump from down there as you pull your skin and bring the lymphatic fluid into the superficial, the more surface area of your body. I recommend doing this at night when you've had a long day at work and you really feel that pressure in the forehead or pressure behind your eyes, or if you feel like you're about to catch a cold. This was a great exercise to help your body fight off those pathogens by allowing your lymphatic system to bring in the macrophages and whatnot. But for the most part, this is a good nightly exercise. Maybe do it in the bath and use it as part of your spa time.